Okay, class. So now that everyone has completed their self-assessment quiz on the current knowledge you have on restraints, which we will go back to the quiz and look at it after the lesson and compare and contrast how you did with your current knowledge as well as what you learned in this lesson. So going straight into the lesson, this is a presentation on the safe use of restraints. So we'll go over the foundations of what is a restraint. So there are two kinds of restraints, violent and non-violent. So for the sake of this course, we're actually going to go over specifically violent restraint. But for definition reasons, non-violent restraints would be any type of intervention you would use on confused patients, agitated, or patients with dementia to prevent them from pulling at their lines, their drains, any tubes of any kind, basically to optimize nursing care. But in this case, we are going to learn about violent restraints. Violent restraints are something we use on patients who are an imminent threat to themselves or to others. And so there are three different kinds that we're going to go over. First off, physical restraint. Physical restraint is the most common form, and it prevents the patient from moving freely or restricts normal access to the patient's own body. These type of restraints would include wrist, ankle, or waist restraints, tucking in a sheet tightly so the patient can't move, keeping all four side rails up to prevent the patient from getting out of bed, or using an enclosured bed. Secondly, you have chemical restraints. And chemical restraint is the use of a drug to restrict patients' movement or their behavior where the drug or dosage used is not an approved standard of treatment for the patient's current condition. Finally, you have seclusion. Seclusion involves keeping a patient alone in a room involuntarily or against their will and preventing them from leaving. Seclusion rooms are commonly found in emergency rooms and psychiatric units, so you won't likely see this on the med-surg floors. So these are all your types of violent restraints. Through the course of this class, we'll go over the risks of using restraints. We'll go over the alternatives to using restraints, some measures we can use to keep from having to use them, as well as the application of restraints. We'll actually get a chance to put restraints on each other and make sure that we're applying them correctly. We'll use role play, and we'll each take turns being the nurse and the patient. We'll also take a look at some videos such as this one right here on the correct application of wrist and ankle restraints. We'll also go delve into some documentation, which is a very important process when having a patient in restraints. We'll have some time on the computer, do some documenting, do some scavenger hunts on where to find orders and the policy and basically what and where to document. So basically that is an overview of what we'll be learning throughout this course, and I look forward to it. I hope you do too.